காமிக்கும் மைக்கு கேமரா எல்லாம்.
Yeah, yeah. So எல்லாம் காட்டுது. So I'm seeing myself. ஆமா.
ஆமா ஸ்டார்ட்னு கொடுங்க இப்போ.
Yeah, அப்புறம் I've started admitting people.
ஆமா அவ்வளவுதான் ஸ்டார்ட்னு கொடுத்தீங்கன்னா இப்போ பார்ட்டிசிபென்ட்ஸ் கீழே லிங்க் இருக்கும்.
Okay.
பார்ட்டிசிபென்ட்ஸ் கிளிக் பண்ணீங்கன்னா someone is waitingனா அதுல வெயிட்டிங்னு காமிக்கும் உங்களுக்கு.
Okay, participants-ல 2 பேர் இருக்காங்க. There is someone else.
acceptன்னு கொடுத்தீங்கன்னா they can join.
Yeah. No. Participants, there's only one another person apart from me. Yeah.
அப்போ வந்து
Hi, morning. Could you hear me?
Yeah, good morning. We can hear you.
Oh, thank you so much. So I'm Bharani, one of the anesthetists who have done Caesar, and I'm a consultant anesthetist. We would let's wait for another 5 minutes for if there is anyone joining, then we could possibly start. So meanwhile, Dr. Ezuddin Akif. So are you in the UK or are you somewhere else?
Yeah, I just arrived in UK. I'm in Barrow-in-Furness.
Oh, nice. So are you a SAS doctor, SAS doctor, or what job description are you in UK?
Specialist doctor in anesthetics.
Oh, brilliant. So that's nice. Yeah. So yeah, it's good to know, and yeah, I hope the session would be of some help to you. And
And thank you for taking out the time to arrange this.
yeah, no worries at all. Yeah. So yeah, I think with anesthetics, we are a bit lucky to find information. So we have a lot of YouTube channels, many of them with good videos and people who have achieved Caesar, and they are doing this. So in a way, it is very, helpful for many of us to be able to achieve this. I'll give 5 more minutes probably, and yeah, then we'll get started. Uh, yeah, whoever is joining us midway can will possibly get some information from the website. And mostly, if this is recorded and if the details are in the website, then they can go back and look at it. Okay, we'll just give a minute more and just start off. All right. So we'll get this started. I hope you guys can see the screen and are you seeing the PowerPoint? Can you give me a thumbs up?
Bharani, you can make me a co-host so that I can also involve in something.
Yeah, so how do I do that?
Go to the participant, right click.
Okay.
Go to the participant, right click, and then
Screen sharing, is it?
no. Go to the participant. No, on
Okay.
your right. On your right of the screen, right side of the screen, there will be participants. Go to the participant and right click and make me as co-host.
Okay, all right. Yeah, I'll do it. Make co-host.
Yeah, that's right.
Confirm. Yeah, that's fine.
That's fine. Thank you.
Yeah. So are you seeing the screen?
Yeah, I'm seeing the screen. I'm seeing the screen. Yeah.
The slide, is it?
Yeah.
So that's fine. So I think I'll get started if that's okay.
Yeah. I don't know how many participants are there. I will try to see how many participants are there, and then I can help you as well.
We have less than 10. So
that's fine. We can start. That's fine. No problem.
Yeah. So I believe should be okay. And, yeah. So
Maybe.
Hello.
Yeah. You can start. Yeah.
Yep. Hi. So I'm Bharani, one of the consultant anesthetists. I CSER'd and I'm an overseas graduate. I CSER'd here and I'm working in Swansea Bay University Health Board. So I would like to just quickly share my experience with the CSER and probably keep this discussion very simple, breaking down major jargon with the CSER. So moving on, so what we need to understand with this portfolio pathway is sorry for the glitch. So the objectives would be understanding the portfolio structure. So for this, you have a specialist specific guidance document in the GMC website. If you go there, if you could find the specific specialty specific guidance document for anesthetics. So it's your holy book. You just have to download it, go through it line by line, read in between the lines, and prepare your evidence based on that. So as you all are aware, there are 14 domains. I think around 7 are non-clinical and 7 to 14 plus the SIAs are clinical domains. And you need to have the 2021 anesthetic curriculum, which you can download either from the GMC website or from the Royal College website. And once again, you need to have it while you are trying to accumulate evidence or working on CSER or compiling your evidence during the application. So these two documents are extremely important. It's good to have them even before you get started. And so learning mapping. So there are some information about how to map your evidence across different domains in both these websites. There is also a very good YouTube channel from the Royal College which tells you about this. Many videos by excellent people who have achieved CSER in the UK from across the globe. And obviously, these topics are very well covered by talks from experts from this association. So it is actually extremely valuable to have information about, from people from other specialties, how do they achieve these domains and map the curriculum. And extremely useful for the non-clinical domains because it's pretty much the same for all of us, despite being a different specialty. So we just work on those non-clinical domains in a similar way. So moving on to the framework. So this is based on RCOA curriculum, the new curriculum. So there is an old one. So make sure you follow the new one. If I'm not wrong, the new one is 2021 curriculum. And it uses high learning outcomes. So these are basically SLEs, single learning events or documents. They call it as high learning outcomes. So to break the jargon, you can just read about what is HLO in the RCOA website and it will break it down for you. And as I explained before, there are 14 domains plus a subspecialty area. So you would need to have 2 subspecialty areas. You need to pick once you have, if you are overseas candidate or within the UK, if you have any specialist interest like neuro, or if you're doing pediatrics, or if you are very much interested in obstetrics or intensive care, then you might have to spend more time on that specialty and achieve some higher training outcomes or some fellowships. So you have to put in those extra number of hours there and achieve those evidence for the SIAs. Yeah, so as we talked about earlier, so the domain structures are the general domains 1 to 7, which are pretty much similar for most of the specialties. And we would be extremely benefited by other specialties and many talks in this forum by speakers like Varun and Kushan. They have run sessions of how to achieve these domains explicitly. So walking through them, domain 1 is just professional behaviors, communication. 2 is management and your regulatory requirements. 3 is team working. 4, safety and quality. 5 is safeguarding. 6, education and training. Most of your teaching experience comes into that. And 7 is research and managing data. Any research, QI research, audits, paper publications, journal clubs, anything which can be put into this. And the clinical ones are, this is for anesthetics, obviously. So you would need perioperative medicine and healthcare, which mostly covers perioperative clinics management. General anesthesia is anesthesia with all the surgical subspecialties. You should have evidence and should have shown that you have worked in a broad range of surgical specialties. So surgeons are our friends. Regional anesthesia. So you need to have evidence of performing blocks, teaching in regional courses, having evidence of attending courses, conferences, workshops in regional anesthesia. Resuscitation, transfer. So while you submit the application, you should have a valid in-date Resus courses certificate, which are Resus UK approved accredited ones, not the American ones. So I understand we have many overseas graduates who follow the American AHA adult Resus courses, have a certificate, spend some money on that. But then, however, I don't think, I might be wrong, but they are not, I think, Resus UK accredited. So either it has to be European or it has to be from the UK Resus courses. And you also have transfer courses, and your ATLS, adult trauma life support courses, are also accepted. Procedural sedation is providing sedation or out-of-theater anesthesia for any procedures as small as small suturing in a A&E to joint reduction to anything, to MRIs, CTs, sedation for endoscopies, colonoscopies, anything can be put into that. And pain medicine. So this is both acute and chronic. So I believe most of practicing anesthetists will have good evidence and experience on acute pain medicine or post-surgical pain management. So we generally make a plan for the post-operative analgesia plan and do the post-operative surgical rounds with plans, tweaking all those analgesia requirements. And also we need to make sure we have some clinics in acute and chronic pain. So chronic pain clinics are important. So if you don't have them, you need to get them, achieve them. You need to attend some chronic pain clinics with the chronic pain specialist. And with interventional pain procedures, as you are not doing a Caesar in pain medicine, it is not expected out of you. However, having 1 or 2 sessions with the interventional pain specialist is always of great value for your Caesar application. If you are able to get one, I would highly recommend to do something, have some sessions along with them. Like, so if you are attached to a hospital where they have chronic pain interventions being done, you can join them in few sessions and probably assist them in procedures like any neurolytic blocks or spinal cord stimulators being placed by the interventional specialist. Intensive care, definitely it's a part and parcel of the anesthetic training, though it has moved away as a individual specialty by itself. We are still a part of intensive care and we do provide intensive care for many of the patients. So this is quite an extensive evidence which is required. And if you are choosing it as one of your special interest areas, then you would have to have a year or more in intensive care with some extra qualifications or fellowship certifications for that. And obviously special interest areas. So we will come to that. What are they in the following slides? So these are few important websites which I thought might be very useful for all of you. The Royal College website, if you go and just search portfolio pathway, it brings you to this web page which has loads of information for you. Each and every one of them is important. If you have a GMC number, then you have access to this website. I'm not sure if you're able to access the elfh.org.uk. So this is a learning platform, lifetime learning platform, kind of a CPD website for people in the UK who work in the NHS. So they would have access to this. So it has a lot of courses, a lot of CPD modules. You can find a lot of generic domain CPD courses there, like leadership management, GDPR, human factors, safeguarding, adult safeguarding, child safeguarding, all of those there. So if the overseas candidates can get access to it, well and good, you can work through it. The other website is the specialty specific guidance, as I mentioned. You can get it from the GMC, or your good friend ChatGPT can help you where it can be found. Please do subscribe to the YouTube channel of RCOA. It has a lot of videos of everything, and for the logbooks or the single learning events or the workplace-based assessments. So they have a platform. They call it Lifelong Learning Platform, LLP. Even if you are out of the UK, you still can have access to, probably through subscription, you can access the LLP platforms. So it is a one and all platform. It has a logbook in a format accepted by the for the Caesar and the portfolio pathway. It has all your workplace-based assessments, all your SLE forms, reflection forms, activity forms. You can get all those filled online, get it signed off online from your consultant. So there's no need of any paperwork being done, like hard copies being printed out and then get it signed from your assessors and do it. So you can add your assessor even with the normal Gmail address. Who has a Gmail address, those forms can be sent and they can just sign it off. It comes back to you, and you can download it as a PDF and upload in your application form for the CSER. So for any reason, if you are unable to access ELFH for overseas candidates, so you have, if you subscribe to BMJ Learning, the online courses for healthcare professionals, it's an amazing website. It has a lot of courses. This is like one of your Future Learn or Coursera websites where you have an annual membership and you keep doing certificates and courses. So this is very good, and many of the certificates you will find it here, and the CPDs and the certificates can be used for CSER evidence. So yeah, it's a bit excessive in domain one, but however, I won't spend much time on them because I think Varun and the rest of the team with their multiple sessions earlier have spent enough time on that, and I think they would be coming back to it again and again with a lot of workshops which are going to happen soon. So this is basically professional behavior and communication. So what you can do to demonstrate your professional behavior is if you have any workplace assessments or an SLE, get it signed off from your consultant just to say that you are the sole anesthetist professionally kind of conducting the management of the list. And so that's one way of doing it. And other ways are like you can have many personal activities and reflections. These are courses which can be found on these websites like BMJ and the ELFH, the leadership management courses, equality, diversity courses. Any e-learning attendance on these are accepted. And so make sure you have a SLE or a workplace-based assessment with an evidence of effective shared decision-making with patients and colleagues. How do you do it? If you have attended an MDT for a case, you can include that. If you have attended a pre-operative clinic, if you have had a difficult discussion about the risks, benefits of surgery, especially in oncology surgeries or any surgeries, if you have a very sick patient, if you are discussing risk with them, just document it, get it signed off by one of your superiors. So that's an easy way of doing things. And your professional portfolio and CV. So this obviously you will get it ready before you submit your application. The next thing, management of a difficult conversation with a colleague or a patient or a relative. So this can be anything. So if you had a disagreement or if you had a bad day because of, as we are working with different kinds of people, we can have a bad experience. So you can kind of reflect on those experiences and probably discuss it with your superior or the consultant and get it signed off as a reflection or SLE, or a difficult discussion with the patient, like end of life scenarios in ITU, not resuscitating or not escalating care. So these are good examples of it. And active listening in range of environments and situations. You can have get a CPD course done for them straight away. It's like a bystander course or anything like that in the BMJ. And patient feedback material. So you would be doing this in your appraisals, yearly appraisals. I would recommend you to get some colleague feedbacks and patient feedbacks. These can be used for your appraisal, and that can be used for CSER as well. And you obviously would be doing some leadership quality, some quality improvement project. So you would be leading or you would be a part of it. So you need to show that evidence proof of it in the form of certificates. Also, please include the presentation slides or posters if you have presented somewhere. And if you have presented in your audit meeting, then please do include the program of the audit meeting and make sure your name and your presentation is mentioned in that. So that becomes a proof of your quality improvement project. And there is a workplace, there is a SLE, AIQPAT in the LLP. you can put all of these in, get it signed by your consultant or a superior, and that becomes an evidence, and you can submit it for Caesar. And yes, so training with members of senior hospital management. So you can, well, as a senior trainee or a SAS doctor or someone who's trying to achieve Caesar, you can go and join these management meetings as an observer. That's what most of the people in training do in their final years while they are trying to achieve CCT. They go around and see how the management functions, administration functions. Can be any meetings. It doesn't have to be the anesthetic clinical governance meeting. It can be in a higher general board meeting as well, or even a nursing governance meeting as a healthcare professional and a multidisciplinary team. You have a role in it, and you can just attend that and collect evidence from that. Yeah, you can basically get some feedback or correspondence, have it as a proof, and submit it. And if you have had any complaints through your appraisal from patients or colleagues, or any complaints raised otherwise from the team members, so what we do here is we do a reflection on it. We discuss that in our appraisals, and yeah, so there is a significant event form, and you do that and see how it can be done better or prevented next time. Basically collect that evidence and put it in your appraisal and put it across for in the Caesar application. So we have come across people who have never had complaints, so they are fortunate enough not to have. However, so when you put in the Caesar application having no complaints, but as they have to tick box this, if you don't have any complaints, evidence of this, you would have to do a CPD or a course. There are multiple courses available, how to manage a complaint and how to go through the complaint process, documentation and the reflection on that. You can do that and submit it as an evidence. So yeah, this is something important. If you don't have any complaints, make sure you do a course, get a CPD certificate, write a reflection on it, and upload. So moving on to domain 2. So it's management and regulatory. So once again, if you are the person who have managed some rotas for juniors or your colleagues, or if you are into any management role of conducting something, organizing teaching, conducting workshops, get those evidence. If you are able to generate a certificate for it, good enough. If not, just get it signed off by your superior as a CBD or a ALMAT and just upload it. Then roles in regional training program or a trainee representative. So these are especially for people in training. They could have it. If you don't have it, it's not an issue. You can give evidence of it through other means, like the ones I said before, or if you have participated in any other activity, which in training of nurses, other healthcare professionals, medical students, you can provide that evidence. And yeah, so once again, it's rota management. If you have done any rotas for any healthcare professional, you can include that. And if you have attended any trust board or hospital level meetings, management side meetings, you can include that. You can cross-link to the domain 1 as well, because these are inter-exchangeable kind of domains. And you have a lot of courses, CPD courses and certificates which you can achieve for this domain in those websites which I have mentioned. So like clinical governance, information governance, then managing difficult interactions, So you can get those certificates done, and make sure you write a reflection for that and include it together while you upload. And involvement in writing a report for the coroner. So most of us will not be involved in this, but however, GMC and other bodies, professional bodies, do encourage all their clinicians to have some training in this. So we have a lot of courses on these websites to how to write a coroner report for the coroner if there is a medical legal indication. So this can be done through some CPD course. And yeah, experience of healthcare systems outside the UK. I believe it should not be a problem for overseas candidates, as we have worked in different healthcare systems. So that experience can be used to evidence in this domain. Domain 3. So this is team working. So team working is fairly easy. So you obviously are the lead anesthetist for your team in the theater. So you can get a couple of certificates on courses and some SLEs on that. And if you have, so we do a bit of debriefing at the end of a normal list or emergency list, or if anything goes wrong with your patient, we do a debriefing session, and you can evidence that you have been the head or directed the debrief discussion, or in any resuscitation, if you're resuscitating a patient, whether it's a successful or a unsuccessful, then you can mention the debrief discussion here. And as mentioned before, you have a lot of courses and e-learning. So the ones you have to look for in this domain are leadership management. So this can be cross-referenced with the first two domains as well. Human factors, this is important. You would find the human factors courses in BMJ learning, the website, and also in the ELFH if you have access to it. And if you are an appraiser for any juniors, so that is good enough. Major incident training. If it is not in practice in your hospital overseas, then you could get it done in the form of a course or a certificate. And risk management. So once again, these are certificates which can be done. And if you are a part of any simulation course, can be anything, any clinical scenario or a non-clinical scenario, please create evidence for that. And any projects you have been involved with as a team or a leader, get some information about that in form of evidence of participation, some slides, abstracts, or posters if you have presented. Yeah, so it is, I think with the non-clinical domains, most of it is you would have done. And it's just how to accumulate or create evidence for that. So if you haven't, if you have done and if you don't have evidence, you can go back and create at this point in time. If not in the future, then make sure you work in the path to create evidence for CSER applications. So moving on to 4, it's safety and QI, quality improvement project. So you can have 1 or 2 QIs. So the only thing is, so you need to have a specialty interest area in anesthetics, so that you need to pick 2. So you need to have a QI in one of the 2 or preferably both. So make sure you choose, if you're going to choose a QI in the general side, do a QI on one thing, and you're going to pick a SIA, like if you do a QI in general anesthesia, so that's done, completed. But you are picking SIA, one is obstetrics, one is pediatric. And if you don't have any audits or QIs in that, then your application might be unsuccessful in the first attempt. So there is a high possibility of it coming back with recommendations, asking you to do some audits or QIs on your SAA areas. So be wise if you're doing some audits or QIs. So pick those SIA areas which you are interested in and do those projects in those areas so that you can kind of cross-link all your evidences. So yeah, so once again, promotion of safety in theater lists. So this can be done as a CPD course, which is available in that website. And as mentioned here, the courses, these are all cross-referenced, can be cross-referenced with other domains, 1, 2, and 3. So safety science. So there are e-learning courses in ELFH and BMJ. You can get those certificates done, and that's good enough. Well, it's difficult to say, do you need to do every one of these which is mentioned in these domains? However, if you're able to do it, it's good enough, because with the non-clinical domains, most of these things can be done as a CPD or a course or an e-learning event activity. So it's easier to get these done than sometimes the clinical ones to achieve. Yeah. So running through the other parts in this domain is pretty much the same. If you have done any mortality reviews, you can do them. If not, you can do a CPD course and do a reflective piece on that. Once again, clinical governance meetings are audit meetings, mortality, morbidity meetings, which can be cross-referenced with other domains from 1 to 3 as well. So these are pretty much interexchangeable evidences. So moving on to 5, safeguarding. So this is very interesting. So in some places in the overseas, we do safeguarding, but it's just that we don't have documentation for that. So once again, you have safeguarding courses in those websites. You can do them. I would highly recommend doing adult safeguarding, level 1, level 2, pediatric safeguarding if you're doing peds anesthesia, level 1, level 2. If you want, you can do level 3. And also management, get a workplace-based assessment like a SLD or a CBD or something, or AKEX. Of management of a vulnerable patient for surgical procedure. So examples of a vulnerable patient is someone who can't consent, like learning disabilities, dementia. It can be a kid, it can be an elderly patient with dementia. So these are the patients who are vulnerable. So just create an evidence for one of those patients, and you can use it in this domain. And this is management of vulnerable patient in distress with potential to require restraint. So this is something with the Mental Health Capacity Act. So you can do a CPD course or get a certificate online in one of those websites. Just go ahead and do a mental health capacity e-learning. You can do that and upload. And if you encounter a patient, so we do have patients here coming from prison who are in restraint. So we do anesthetize them. So that is a good example of an evidence for this domain. Yeah. And the other thing is management of a case where cultural or religious differences affect consent and treatment. This is pretty much easier to get done in UK or probably elsewhere, because it's a diverse community population. We are dealing with people from different backgrounds. And we do encounter patients who can't speak English. So we do use interpreters, language interpreters for consenting and the whole process of taking care of them through surgery and post-ops. So, which is a very good piece of evidence to accumulate. And yeah, as mentioned here, there's a lot of courses on equality, diversity, counter-terrorism, child and adult safeguarding mental health capacity. So these are the ones which can be put in this domain. And best interest decision. So this can be anything. So this can be like do not attempt CPR in patients in ITU, or generally it's very common for elderly patients or patients with terminal illness to make this wish or consent to not to be resuscitated or not to escalate any care. So these are good pieces of evidence for you if you have handled these patients to be submitted in this domain. Yeah, moving on to domain 6. It's education and training. This has been well covered by Varun, Kushan, many of us from the forum. So lots of teaching not just to your own specialty. It can be medical students, other specialties, nurses, physician associates, anyone, healthcare professionals. So make an evidence for it. Like as Varun says, nothing is free. So you plan it well, create an evidence, create a feedback, and then put it across in this domain. And the important thing with the CSER application is anything you do has to be contemporaneous, they call it. It has to be continuous. It's not just I've done one and I don't do teaching for another 4 years and submit my application. No, there can be chances that it would be picked up and they would ask you for more teaching sessions because you have just done one and you're not doing it continuously. So make sure you do one every 3 months or one every 6 months. You have a decent amount of teaching evidence proving that you are doing it continuously. Yeah, once again, this is pretty much the same, interchangeable with the other domains. A lot of teaching sessions, regional, national meeting. If you have presented or attended anything, then probably accumulate all the evidence with the presentation, the program, the posters, and then upload it with some reflection. That would be great. And if you have been a teacher, like if you have been someone who has assessed postgraduates in your country, you can use that evidence. And if you have any academic qualifications, like so they do diplomas and PG certs in higher education in the UK. So if you have anything similar to that, any educational qualifications apart from the clinical ones which we have, those can be put in these. Yeah. And moving on to 7. This is research and managing. So I don't know, it's fortunately or unfortunately, anesthesia doesn't require any publications so far, unlike the surgical specialties. So you are at luck. So you just need to have attended, you obviously need to have done some audits, completed the audit cycle. You should have done some quality improvement projects. It would be good if you had presented them in your local hospital audit meetings, have evidence of that, or if you have presented in some local conferences with proof, national, regional, international is not mandatory. Any publications as simple as case reports, letter to the editors are even accepted. If you have them, it's fine. If you don't have them, don't worry if you are someone who's about to submit the application, because until now, anesthesia CSER is not looking for any publications. So that is good. However, in the NIHR website, so that's another website for research, NIHR UK. So if you go in there, you have they call it good clinical practice. So there is a course there which is free. You can do the course, complete the course, get a certificate and upload it in this domain. So which is one of the good evidences for this. I will now move on to domain 8. So we go from non-clinical to clinical domains. So domain 8 is perioperative medicine. So it's all about pre-op assessments. Though we don't have clinics, we do many of us, most of us as anesthetists, we do pre-operative assessment apart from the regular pre-op clinics. So make sure you include these sessions and maintain that in your logbook, and also create an evidence in the form of ALMAT or CBD or anything signed off by your consultant, like proof that you have gone through these clinics. So what type of clinics? All types of clinics. If, for instance, in your special interest area, if you have chosen pediatrics and obstetrics, is for example. So in obstetrics, you need to have sat in high-risk obstetric clinics. Planning assessment of this patient, having a plan of anesthesia for childbirth for this patient. So you need to have evidence of that. Seeing complex patients. In pediatrics, obviously, seeing kids for various procedures. And in general, other surgical specialties, if you're sitting in a preoperative clinic, you should have a wide variety of surgical subspecialties, anesthetizing and seeing them in the clinics. So you should have good evidence of these to be put in this perioperative medicine. And yeah, e-learning courses, once again, if you have attended any scientific meetings on peri-op medicine, which is good. There's a lot of online courses. There is one one course in perioperative medicine by UCL, University College of London. I think it is in Future Learn, if I'm not wrong. It's a paid subscription. You get a certificate at the end of the course, which can be evidenced in this domain. Make a note of it. And there are courses on environmental impact of anesthesia and anesthesia in developing countries. So which is very much easier to do in the current climate of events. Moving on to domain 9. So moving on to domain 9, we have general anesthesia. So this is once again CBDs, ALMATs, and others from a range of surgical specialties, everything. To have some guidance, go through the RCOA curriculum. And most of this, so you are evidencing to become a consultant. So your stages, so don't get stage 1, stage 2 evidences or attach those clinical cases. So you should be attaching evidences for in the consultant level. So it should be level 4 or level 3 for most of your evidences. Anything less might not be accepted. And you should have evidence of providing safe anesthesia for diagnostic and therapeutic procedures outside the operating environment, including remote sites. So this is something has been spoken about by in many of the applications. They say this bit of evidence is lacking. So there is a lot of evidence of providing anesthesia in the theater. However, outside the theater, so these areas are endoscopy suites, colonoscopy, interventional radiology, ECT. If you ever have some chance to do some anesthesia for electroconvulsion, it's a great place. And if you're doing any other procedures in even a regional block in outside the theater in some clinics, so those can be used as evidence. Yeah, as mentioned before, ECT radiology. Oh yes, cath labs. Cath labs is another thing. Like cardioversions, both elective and emergency. You can evidence that's for this outside the theater, remote site anesthesia. And make sure you see patients or include evidence of patients with who have had congenital or acquired heart disease coming in for a non-cardiac surgery. The same way someone who has had a neurological neurosurgery for anything like aneurysm or SDH or something coming in for a non-neurosurgery. So make sure you have these evidences in your logbooks and some SLEs on these. So general anesthesia domain is quite exhaustive. It will be a major chunk of your evidence, I would assume. Then moving on to 10 regional anesthesia. So regional is apart from, you can do it as an SAA as well if you are somewhat a regional enthusiast, but however, it's also a part of the domain 10. So you can cross-reference, cross-link your evidence in both. If you are picking SAA, regional as SAA, you can cross-link. However, for SAAs, you would need more evidence, and you would spend more time to achieve those as an SAA. That's what is expected out of you as a specialist regional anesthesia person. So for RA, you can use courses, regional anesthesia courses, preferably the ones with cadaveric dissection and cadaveric models with ultrasound guided blocks. And they specifically ask for rib fracture management courses, chest wall trauma certificates. So make sure you have those in them, like serratus anterior blocks or ESP blocks for rib fracture management, apart from just the thoracic epidurals. And make sure you have some evidence of doing those and with catheters, single shot and with catheters as well. So the RCOA curriculum has something called as Plan A blocks. These are the blocks like your regular brachial plexus, your tab blocks, your lower limb blocks like femoral, sciatic. Yeah, and I think serratus is also there, rectus sheath blocks, serratus. So you can find what are they in the RCOA website and make sure you have evidence for all of those. And yeah, make sure you have an evidence for this as well. Chest wall independently, they are very specific for that. And yeah, pretty much it's quite exhaustive, but you need to have more numbers in the logbooks, attend certain courses, probably taught regional anesthesia to your juniors. Yeah, and the logbooks with some workplace-based assessments, and make sure you also attend a course, regional anesthesia specific course. So that is quite useful for this domain. Moving on to 11. So we have a resuscitation and transfer. So this is, again, it's very helpful if you have evidence of doing those courses like adult resuscitation, pediatric ALS, pediatric resuscitation. Then there is something called as a transfer course. You can do it when you are here in the UK, and you have many certificates, online courses which can be done, but it is mandatory to have these Resus UK Council accredited or approved courses while you submit the application. And, yeah, as explained before, the DNA CPR, so you need to have some evidence of discussing this with the families and the patients and have some evidence created for that. And as mentioned, courses in learning, resuscitation, human factors, breaking bad news. It's quite easy to get these experience from learning websites, and as well as when you are in ITU, these you will have abundant opportunities to get them done. Domain 12 is sedation. So the ones you used earlier for a remote site anesthesia can be used here as well. You can cross-reference them. This is pretty much the same, so I'm going to move to the next slide. Pain medicine, as explained to you before. So you need to have sat through a pain clinic, both acute pain, chronic pain. If you have made some management or a SOP for guidance or guidelines in your hospital, that's very useful in pain. And you should have evidences for leading a pain round. So the pain round generally in the UK, it involves pain specialists like pain medicine doctors, anesthetists if you're a pain specialist, and also nurse pain specialists. And so we do have pain physician associates who are pain specialists as well. So it's a multidisciplinary team. So they generally do rounds every day of post-surgical patients and patients who are needing pain specialist review. So you need to participate in those. And if, it's not very uncommon to have patients who are intravenous drug abusers. So they are generally, they come for some procedures, elective and emergency. You make sure you create evidence for them, put it in your logbook, get it signed off by your consultant. They are difficult IV access, difficult perioperative and postoperative management for pain as such. So it's a good piece of evidence. And people who are on chronic pain, on medications, I think we have a big number of patients coming to elective and emergency procedures with a lot of chronic pain issues. So it's not difficult to get hold of evidence from these subspecialties. Yeah, intensive care, this is quite exhaustive, like the general anesthesia model. So probably we would be doing 3 years of intensive care or 4 years in your whole duration of your postgraduate training. And even after that, if, yeah, it could be a bit tricky for some people who have moved away from intensive care. So then that becomes a challenge. Especially for overseas or even in the UK, there are anesthetists who have moved away from intensive care and just to anesthesia. So this is a challenge. If your evidence is older than 5 years or 7 years from the time of your submission of the Caesar application. So you need to think about it. You might not, that older evidence, older than 5 years might not be accepted. And they are also looking for continuous, contemporaneous, experience in intensive care. Just be mindful of that. So you need to get these evidence. So one tip for this is if you are able to use, generally some trusts are very kind enough to give you rotations. However, it is not possible. So people sometimes take annual leaves, go and get this done somewhere else. They get the necessary agreement and paperwork for this, use their annual leaves, travel and get the necessary evidence, work through the intensive care and get those evidence back, and those evidences are accepted as well. So this is something if you're unable to do intensive care in your regular job. So next, yeah, probably is the last slide, special interest area. There are lots. of special interest area. So you will find a document in the RCOA website, like high learning outcome for stage 3 and special interest area. So you must consider it as a holy book. There's lots of information about your SIAs and what you need to do for them, and the duration of the special interest areas, how long you should have worked in those areas on top of your general anesthesia rotation. So group 1 is clinical. You have cardiac, neuro, additional ICM. So these are for people who want to become a cardiac anesthetist or a neuro anesthetist, or a mix of both, and additional ICM, obstetric, pediatric. So mine is obstetric and regional. So I did a couple of extra time in obs and regional. Group 2 is like acute pain, as mentioned, bariatric, complex orthopedic, hepatobiliary, major general, ophthalmic, all of these. So you need to have one from group 1 and one from group 2, or there is some leeway for this, which is mentioned in the document of special interest area. So you can go ahead and have a look at that. So, and practical procedures. So make sure you have these. You might have been a senior consultant anesthetist or even a professor elsewhere with years of anesthesia experience. However, you need to have some kind of workplace-based assessments for these simple things like laryngoscopy, the supraglottic airway insertion, intubations, IV cannulations. You won't be surprised. So I had one of my colleague who did his Caesar, who is a consultant anesthetist for more than 15 years. He Caesared, and in his first time he applied, it came back with recommendations for him to do a couple of lumbar epidurals and a couple of ultrasound guided IV cannulations. So they wanted some more evidence on that. So it sometimes is just demoralizing. However, just for you to be aware, just have a look at this document. So this is an extract from the specialty specific guidance in anesthetics in the GMC website. So, and the level of supervision for mostly, you would consider you to be an independent practitioner, so it's preferably 4 or sometimes 3. Yeah. And yeah, so just a reminder, it's like you need to have these documents and continuously work alongside when you are accumulating Caesar. These are the important ones. Just to reiterate them, the specialty specific guidance, CCT curriculum, the latest one, 2021 from the RCOA, stage 3 special interest areas, the HALO guide, which is an RCOA as well. And you have a lot of information about the portfolio pathway in the Royal College. And please make sure you kind of use the LLP platform, which is widely accepted for Caesar applications, if you get access to it. Yeah. Thank you so much. I leave you here after this long talk. If you have any questions, please do ask.
Yes, can we have sign as a supervisor from one outside the UK? If we have a consultant and don't have any accreditation from UK, can we use him as a supervisor and use his sign?
Oh, yes, absolutely, yes. So that is not a problem at all. So your supervisor doesn't need to be UK trained or doesn't need to have any UK qualifications. nor he or she needs to be registered with the GMC. Absolutely don't worry about that. Anyone who's practicing anesthesiologist or intensivist in their own country, registered with the medical council of the country, is good enough to sign off your papers. So absolutely don't worry about that. Yeah.
Can I ask something?
Yep.
As regard the evidence related to experience of healthcare system outside the UK, what
Yes.
kind of evidence that can I apply or can I present?
Well, so wherever you are working, for instance, Africa or Asia, so your healthcare system is very different. So what it means is, so your hospital will have policies. So they will have some policies for accreditation, like CQC, they call it Care Quality Commission here. So your hospital will have some quality um, associations. So you can be a part of it, and so you will have your own criteria for assessments. So generally we follow your criteria for fitness, preoperative fitness, and you will have your own hospital or regional guidelines. So if you have participated in creating them or introducing them, or making any changes or making any updates on them, so these can be used as an evidence. Yeah.
Okay, thank you.
All right. So I'm not sure. Probably you will get the feedback forms by email, if I'm not wrong. So yeah, please do fill in the feedback forms. And if you don't have any questions, thank you so much.